Today on Dr. Osborne Zone, we're going to be talking about a supplement that has the potential to change your health. Now, this supplement can't be gotten in doses high enough in your food, and you're going to want to pay particular attention to some of these benefits. Improvements in your hemoglobin A1C, that's your average blood sugar over time, improved insulin sensitivity, reductions in blood glucose, improvement in diabetic neuropathy, preservation of your vision, especially in diabetics, improvements in cognitive function, weight loss, improvements in heart rate variability, as well as improvements in blood flow and ability for blood to deliver oxygen and nutrients to your tissue. So if you want to learn more about this supplement, stay tuned tonight because we're going to be doing a deep dive on it, including the research, how much you can take, what more of its benefits are, and so much more. Stay tuned. We'll be right back. You unlock this door with the key of compassion. Beyond it is another world. A world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's Zone. Welcome to Dr. Osborne's Zone. Today we're going to be doing a deep dive on the supplement Alpha-Lipoic acid. So what is alpha-lipoic acid? Alpha-lipoic acid was originally discovered in 1937. And it's a compound our body can produce. It's a very powerful sulfur-containing antioxidant, and generally it's derived from cysteine, the amino acid, which is sulfur-containing, and something called caprylic acid. So your mitochondria actually can, with these raw ingredients, can produce alpha-lipoic acid. And one of alpha-lipoic acid functions is that it's a very, very powerful antioxidant. Let's blow up this screen here and have a look. These two here are lipoic acid. And so you'll see in the center CoQ10, vitamin C, and then this substance here, 2-GSH, that's glutathione. So these are three very powerful antioxidants that help to regenerate tocopherol, which is otherwise sometimes known as vitamin E. Now, why are we talking about alpha-lipoic acid in regard to all this? Because one of the things that happens in your body is a natural process, is the formation of free radicals. Now, most of you have heard this term before, free radicals, and the counter to free radicals are antioxidants. So we need antioxidants to cancel out free radicals. Why? Free radicals do damage to our cells, can do damage to our DNA. So if the balance of free radicals outweighs the balance of antioxidants, we're in trouble and we're going to age a lot faster. Well, vitamin E right here plays a major role in helping to neutralize free radicals. So basically converting those free radicals into something less dangerous. And so in the process of vitamin E protecting you, you use CoQ10, vitamin C, and glutathione to regenerate vitamin E. So what happens, vitamin E becomes oxidized and we have to regenerate it to reutilize it. So these three nutrients basically recycle vitamin E. But what alpha-lipoic acid does is it regenerates vitamin C, CoQ10, and glutathione. So think of it as the master antioxidant regenerator. It's the battery that recharges your antioxidant system so that it continues to work for you, preventing the potential for all kinds of damage. Now, let's look at some of the functions of lipoic acid here, and what we're looking at are just generalized functions. So we know that it plays a role in glucose and fat metabolism or lipid metabolism. We know, as I've just spoken, it has an antioxidant effect. It regenerates antioxidants. It also has a reparation effect of oxidized proteins. So if you've got damaged proteins, that alpha-lipoic acid can help to repair those. We know it has anti-inflammatory effects and inhibition of something called NF-kappa B. And it also can chelate metals. So it's used as a metal chelator to get rid of an overburdensome quantity of toxic metals. So these are all some basic functions of Alpha-Lipoic acid. And as you can see here, just as a general, we'll blow this slide up for you if you want to take notes, but helps with cells to generate energy. It's an antioxidant, an anti-inflammatory, helps with glucose uptake into cells. It aids in the metabolism of branched-chain amino acids. What are those? Those are very important amino acids that help to maintain your muscle. And so one of the things that happens, especially as we get older, we're exposed to more free radicals over time. We burn through more of our alpha-lipoic acid. We have less of it to help with the metabolism of branched-chain amino acids. One of the byproducts of aging oftentimes is something called sarcopenia, which is referred to as age-related muscle loss. So we're losing muscle as a consequence to accumulation of damage over time. Alpha-lipoic acid helps us maintain that through the metabolism of branched-chain amino acids, therefore being very important. And then, as I mentioned earlier, it preserves CoQ10 and regenerates vitamins E, C, as well as glutathione. So pretty important overall in its functions. Now, let's look more here at some of the functions of alpha-lipoic acid as it relates to chelation. You can see ALA possesses an excellent iron chelation property. It preferentially binds to zinc, lead, that's Pb is lead, and Cu, which is copper. Where might this be beneficial? If someone has potential lead toxicity or copper toxicity, alpha-lipoic acid might be helpful in that regard. There are a number of animal studies and in vitro studies that show that alpha-lipoic acid can preserve neurological cells that are damaged by heavy metals. We also know several people have a condition called hemochromatosis, which is an accumulation of iron in the tissues. It's genetic. And one of the most common questions I get is what if we have hemochromatosis? Is there something we can do? You might want to consider alpha-lipoic acid supplementation as a result of, or as an effort to, try to bind or chelate some of that iron and prevent it from doing damage, because too much iron can be toxic. But aside from giving blood, so donating blood or giving blood is kind of the standard medical treatment for hemochromatosis. But you can consider lipoic acid. Now, if you're going to consider this, you should make sure that you're monitoring your zinc and monitoring your copper levels, because you don't want to create deficiencies of these two nutrients in your attempt to protect yourself from free radical iron. So just keep that in mind. If you have, iron excess or iron overload, and you're going to use higher doses of lipoic acid to try to kind of offset some of that potential damage, ask your doctor to monitor your zinc and copper. You see down here, numerous studies have strongly supported the role of ALA in treating diabetic neuropathy. We'll talk more about that in a moment. ALA does so by enhancing nitric oxide-mediated endothelium-dependent vasodilation. Basically, that's Greek, but let's make it English. It helps your blood vessels dilate, therefore improving blood flow in the microcirculation, so getting more oxygen, getting more nutrients into the deep tissues, and especially this is supportive in patients with diabetic polyneuropathy, so those diabetics that have developed neuropathy as a result of poor blood flow. Blood sugar, elevations in blood sugar, just like sugar makes the floor sticky at home, sugar makes your blood flow and your bloodstream sticky and reduces your blood flow. Now, if we look at some of the research studies where, and then what I'm going to talk about today are human research studies. There's a lot of animal studies. There's also a lot of in vitro or petri dish studies on the benefits or the potential benefits of lipoic acid, but I'm really going to focus today on some of the human research studies that we know show benefit in humans. And so in summary, these are some of the categories here we'll go over. We know that alpha-lipoic acid in diabetics reduces hemoglobin A1C, which is this average of blood sugar over time. We know that it improves insulin sensitivity. So it helps your insulin work better and helps you require less insulin. We know that it can also reduce fasting blood glucose. Now, what is on this note? So these are all related to the impact of blood sugar. Obviously, one of the things you want to know, if you're going to consider using lipoic acid as a supplement, and you start taking high doses, and for diabetics, there are research studies that show anywhere from 100 milligrams a day up to 1,200 milligrams a day of lipoic acid. You want to monitor your blood sugar, because one of the side effects when you lower and improve these things is your medicine, if you're on metformin or if you're on Ozempic or any of these other diabetic medications, your blood sugar might drop too low. And so if you're getting dizzy, if you're getting what we call hangry, hungry, angry, headaches, fatigue, these are all potential signs that your blood sugar is dropping too low. Now, if you're diabetic and you're going to do this, you should be monitoring that blood sugar, because if it starts to drop and it goes too low, obviously you want to have a conversation with your doctor about adjusting your medication accordingly. Now, we also know there are a number of research studies that show that lipoic acid improves diabetic neuropathy, and we'll talk more about that as well. There's a condition in diabetes, a lot of this is linked to diabetes because most of the research on this nutrient is around blood sugar, but there's a condition of diabetics called retinopathy. This is when blood sugar starts to damage the eyes. And so in some studies, what they've shown is that visual contrast sensitivity in diabetics is typically pretty poor, but those that take alpha-lipoic acid, not only do we see enhanced improvements here, but we see preservation of eye function in diabetics who take alpha-lipoic acid. We also know Alzheimer's. There's improved cognitive parameters, and there's also reduction in inflammatory markers of the blood linked to Alzheimer's. So human studies have shown both. We know that it improves weight loss, and this is even in people. What's interesting about the weight loss studies is they compare people taking it and not taking it, and being on the same types of diets, and the people in the lipoic acid group have better weight loss, have better improvements in their BMI. So we know it definitely can impact weight loss. Heart rate variability, which is very interesting, because the worse your heart rate variability, the greater risk for things like heart attack, stroke, and metabolic syndrome. So we want to see excellence in your heart rate variability. We also know, as I mentioned earlier, it enhances blood flow or improves blood flow. And this has been measured in a number of human studies where they measure dilation of blood vessels. So all that to be said, let's dive into some of these research studies and talk about them and show you some of these results. Okay, this first one here, the effects of lipoic acid supplementation on blood pressure. And so you can see this is a review study or an analysis of multiple studies. In this case, it was a total of 11 randomized controlled trials with 674 patients. And you can see here, ALA, alpha-lipoic acid, supplementation significantly reduced SBP. That's systolic blood pressure. That's the top number. And you can see 5.46 was the average reduction in these patients. So it reduced the top number, the systolic. So remember, systolic over diastolic is generally the way doctors give your blood pressure. And you can see it reduced systolic on average 5.46. And this was again an 11 randomized controlled trials with 674 patients. You can see it reduced diastolic blood pressure here, an average of 3.36. So we got 3.36 point reduction on the diastolic side. And this is just supplementation. This is not diet. This is not exercise. This isn't other things that people typically can do to lower blood pressure. So that's a pretty substantial reduction just from taking supplementation. And you can see here dosages in terms of how much alpha-lipoic acid was used. The average was 800 milligrams a day in these trials. And study times were about 12 weeks. So 800 milligrams a day, 12-week time frame, 5.5-point reduction on the top, 3.3 reduction on the bottom for blood pressure. Not bad for a simple nutrient. Okay, let's look next at, we've talked about the blood flow component of improving blood flow for alpha-lipoic acid. And so this is a study done where you can see 5 studies, including 6 effect sizes, and 300 participants were included. So this is a review, meta-analysis of multiple studies as well. Their results showed that alpha-lipoic acid supplementation appears to improve the EF. The EF is endothelial function. Well, let's talk a little bit more about what that is. So your blood vessels, you know, the tubes that run through your body that deliver the vital oxygen and nutrients, if blood flow's going this way. Well, the blood vessels, the layer of blood vessels, the outer layer is, there's a muscle. It's a smooth muscle. And so blood vessels, just like any other muscle, can contract and relax. If you get a relaxation of smooth muscle, you actually, in a sense, you get dilation out. So you get the vessel actually dilates out, opens up more. And this is, when you open up that circumference, you get better blood flow, you get better oxygen and nutrient delivery. And when you have the opposite of that, which is contraction, then the blood vessel closes in and it narrows. So the hole narrows, the pressure goes up and that hole narrows. And so now you get less flow of oxygen, less flow of nutrients. So obviously if we can take something that can improve the dilation, right, that can function here by helping that blood vessel expand, then ideally that's going to have impacts on blood pressure and nutrient delivery. So that's a good thing, especially those of you with pre-diagnosed hypertension or high blood pressure, and you're trying to figure out ways to kind of support your body through this. So, you know, most doctors won't prescribe lipoic acid to get blood pressure reduction. What they'll prescribe are medications, right? Many of these medications, like diuretics and ACE inhibitors and angiotensin receptor blockers, what do these medicines do? These medicines, many of the blood pressure meds, will reduce B vitamins, which are important for energy and important for control of heart disease risk. But one nutrient in particular they'll really affect is CoQ10. Now, how does that relate to lipoic acid? What did we say earlier? That lipoic acid helps to regenerate CoQ10 and preserve CoQ10. Blood pressure medicines reduce it. It's one of lipoic acid's functions is preservation of CoQ10. That's why it's so important for heart disease and blood flow and everything else. So if you're taking medicine that blocks this nutrient, you're going to put more demand on lipoic acid potentially. And so we really want to look at lipoic acid, you know, as a potential here. Now, one, it's virtually side effect free, especially at reasonable doses. But two, there's no downside. When you take lipoic acid, there's not really a downside for side effects or potential issues. And we'll talk more about the safety and the dosing here in a little bit. But bottom line, it improves smooth muscle dilation of blood vessels. This is actually done through nitric oxide production. And many of you have heard of this nutrient, nitric oxide, is very critical for dilation of blood vessels. It won a Nobel Prize a number of years ago for this discovery. One of the things that's responsible for nitric oxide is vitamin C. Remember what we said earlier about lipoic acid's role in regenerating vitamin C. So there's a lot of overlap between a lot of these antioxidant nutrients and their role on vascular function, on free radical protection, etc. But the endothelial function of blood vessels improves. Again, these are human trials. You can see, coming back to it, the results show that ALA supplementation appears to improve endothelial function, thus enhancing blood flow and oxygen deliverability. Now, one other thing to consider as we've talked about, let's redraw this for you. As we've talked about the function of lipoic acid, and we're going to talk more about the blood sugar regulatory effects. But remember, same blood vessel here, blood flowing this way. The higher the glucose, so the higher your blood glucose, the thicker your blood viscosity. Blood viscosity is the thickness of your blood. And if it's too thick, it's going to create an increase in blood pressure. So remember, alpha-lipoic acid, not only can it enhance the blood flow, but it actually has an impact on blood glucose. So there's multiple effects going on here with lipoic acid. It's not just a singular effect. It's a multitude of different effects that are at play here. And so on that same note of blood sugar, let's look at this study on PCOS. So you can see modulatory effects of alpha-lipoic acid administration on insulin sensitivity, again, insulin regulating blood glucose, and obese PCOS patients. PCOS is polycystic ovarian syndrome. What is polycystic ovarian syndrome? In a nutshell, it's diabetes of the ovaries. You know, they call it type 3 diabetes, diabetes of the brain, but PCOS is a type of diabetes. It's affecting the ovaries. It's a major contributing factor to infertility problems in females, and miscarriages and other fertility issues. But what you can see here in this study, ALA administration significantly decreased insulin, glucose, BMI, and the HOMA index. And these are all markers of diabetes in essence. ALA integrative administration at a low dosage, as this is again 400 milligrams daily, improved the metabolic impairment of all PCOS patients, especially in those with familiar diabetes who have a higher grade of risk of non-alcoholic fatty liver disease and predisposition to diabetes. So 400 milligrams a day of lipoic acid improved the blood glucose parameters and the weight of women, obese women with diabetes of their ovaries, PCOS. Okay, this next one is kind of a summary of multiple studies, again, all human trials, on alpha-lipoic acid as it relates to patients that are diabetics. And you see in this case, this is research studies on patients, diabetic patients with neuropathy. So more on blood sugar, more on but in this case, particularly neuropathy. So you can see here in this first study, you've got diabetic patients with mild to moderate polyneuropathy, numbness, tingling, etc. This was a randomized, double-blind, placebo-controlled trial where they were giving 600 milligrams a day of alpha-lipoic acid or placebo, and this was a 4-year study. And so what did they find? They found a reduction of progression of neuropathy. So these patients did not have the same level of progression of their neuropathy. This next study in type 2 diabetic patients with symptomatic polyneuropathy, they gave 600 milligrams of alpha-lipoic acid 3 times a day. And that was in the phase 1 aspect of this trial. And what they find, the total symptom score decreased. So in other words, patients' neuropathy symptoms decreased. They felt better. They had improvements. They did phase 2 of this trial, 600 milligrams of ALL daily, and then had a withdrawal. And then they found that the symptoms decreased in the alpha-lipoic acid treated group as well, and improvements in neuropathic symptoms. So both arms of this study, or both phases of this study, effectively helpful. And they did another one on diabetic patients with early nephropathy, that's kidney damage, and they used 600 milligrams a day for 8 weeks. And what they find? They found that it improved protein retention. That's what this is, a decline in urinary albumin. Albumin is a protein that comes out in the urine when the kidneys are damaged. And so in the case of giving people with nephropathy, kidney damage, which is a common side effect of diabetes. Remember, your kidneys go, and this is why so many diabetics end up on dialysis because of kidney damage caused by excessive blood glucose. But they found improvements in protein retention by the kidneys in these patients. They also found improvements in creatinine in a chemical called malondialdehyde, which is a free radical, and so which is used sometimes to measure potential for damage. And then they also found increased plasma SOD activity. What is SOD? SOD is superoxide dismutase. This is one of the most powerful antioxidant systems in the body. There's zinc and copper and manganese are minerals that help drive the function of superoxide dismutase. These three minerals are depleted by extra or excessive glucose. If alpha-lipoic acid is improving blood sugar, potentially it's improving retention and functionality of these three minerals to help with superoxide dismutase, and that's what they found in this research study. You can see here it also improved endothelium-dependent flow-mediated vasodilation and flexibility. So it enhanced the ability of blood vessels to dilate and for blood to flow. So improvements in blood flow. Then down here you can see in this last study, diabetic patients with neuropathy, 600 milligrams a day orally for 40 days, a reduction in neuropathic symptoms and a reduction in triglyceride levels. So if we look at all of these in totality, we've got improvements in neuropathy, improvements in blood sugar, improvements in kidney function, and reduction in insulin, reduction in blood glucose, reduction in hemoglobin A1C, as well as a reduction in triglycerides. Pretty profound effects when you're talking about 600 milligrams of a supplement. There's not another drug that can really do all of those things in combination. Alpha-lipoic acid is not a drug. It's a natural thing that your body produces. Why doctors aren't recommending this more frequently is beyond me. Let's look at some additional research studies. So let's look at some of the other studies on lipoic acid and the use of treatment with the autoimmune neurological condition called multiple sclerosis. We've got a couple of them here. You can see here at 1,200 milligrams a day, this study was done. It was a double-blind randomized controlled trial, 12 weeks. Significant reduction in levels of inflammatory chemicals. So here we've got interferon gamma, intracellular adhesion molecule 1, transforming growth factor beta, and interleukin 4. These are what these are. If you've not heard of these are chemicals that when elevated signify inflammation, excessive inflammation. And it's that inflammation that creates the neurological damage associated with the progression of multiple sclerosis. So 1,200 milligrams of ALA reduced these inflammatory markers. We also see in the second study, 1,200 milligrams a day for 2 years, significant improvements in walking performance in patients. So it's not just that it's reducing, it's one thing to reduce cellular levels of measurable inflammation, but it's a completely different thing to actually improve an outcome in a patient's ability to function. And that's what this 2-year study showed, is significant, not small, but significant improvements in walking performance in patients. So let's talk about some additional studies. So schizophrenia, which is another condition, is not the same, obviously, as multiple sclerosis. Multiple sclerosis being an autoimmune disease of the central nervous system, whereas schizophrenia is an autoimmune inflammatory condition that affects the brain. And one of the side effects in schizophrenics is that a lot of antipsychotic medications cause diabetes. It's actually one of the side effects is that elevations in blood sugar and increases in weight. And so if you're been diagnosed with schizophrenia and you're on these types of medications, the likelihood of you developing diabetes and complications from that diabetes goes up as long as you're on those medications to treat your schizophrenia. So again, you're trading one illness for another by trying to treat the illness. And so we look at research studies on using alpha-lipoic acid in schizophrenic patients on antipsychotic drugs where they've had induced weight gain. So again, the drugs caused increased weight gain. What they did in this study, and this was, again, a double-blind placebo-controlled trial. It's a 12-week trial where they were giving 600 to 1,800 milligrams a day of lipoic acid or a placebo. And what did they find? A reduction in body weight and body mass index, so improvements there, that's good. They found significantly reduced visceral fat. So both a reduction in visceral fat and a reduction in total body weight just by taking alpha-lipoic acid. Again, this trial was not implementing exercise or other diet or lifestyle parameters, just using lipoic acid. Another study on schizophrenics used 100 milligrams a day orally for 4 months and found significant improvements in neurocognitive parameters. So in essence, these people, again, the functional outcome, it's kind of like what we're talking about with MS, where they walked better. In this case, they had better neurocognition. They could think more clearly. And in this study down here, 500 milligrams a day of lipoic acid, this was a 3-month study, significant increase in plasma adiponectin levels. What is adiponectin? It's a hormone released by fat cells that regulates things like inflammation. So it's very important. High levels of adiponectin are actually a good thing. We want to see increases in adiponectin because it helps improve blood flow and blood sugar and energy utilization. But they also found decrease in fasting blood sugar or glucose and a decrease in something called aspartate aminotransferase. This is a liver enzyme. And one of the side effects of schizophrenic medications is liver damage. And so one of the things we know about ALA, lipoic acid preserves liver function. It protects the liver. It has a protective effect. And so again, in this trial in humans with schizophrenia, they found that it reduced liver damage 500 milligrams a day in a 3-month administration. So these are all, again, we're still on the compound on the nervous system, because schizophrenic being a neurological brain disorder, multiple sclerosis being neurological. We've talked about neuropathies, talked about diabetes. Now let's talk a little bit about another neurological condition, burning mouth syndrome. Now this is something, or scalding mouth syndrome, this is something that we see very commonly in people with mold toxicity, or even more specifically, not mold, but mycotoxin exposure. So mold produces mycotoxins. Mycotoxins are very similar in the way they create damage. They cause free radical damage within the body, and then that toxicity can sometimes lead to nerve damage. And we see it clinically, burning mouth syndrome, in a lot of people who've been mold exposed. So drawing that connection for you, because I want to show you something in just a moment. But in the studies, and there have been a number of them on people with burning mouth syndrome, and this is a review of randomized controlled trials. Here's what they found. Okay, so 9 studies. In most studies, lipoic acid was given at 600 to 800 milligrams a day. So this is, again, your dose, with up to 2 months of follow-up. So 2 months of clinical follow-up. So they were watching these people. The majority of studies, 6 out of 9, so 6 out of the 9 research studies, showed that ALA was more effective in BMS patients, burning mouth syndrome patients, than in a placebo-controlled group, or in the placebo group. So the group that didn't give anything, they gave a placebo, versus the patients that they were giving lipoic acid. The patients with lipoic acid had improvements in burning mouth syndrome. Again, recognizing the mold toxicity and the mycotoxin toxicity, I also want to talk about a couple of other studies here. This one's not a human study. They haven't done human studies, to my knowledge, yet with lipoic acid and mold toxic poisoning. I've done a lot of this clinically, but I haven't seen any major human studies. But you can see here, protective efficacy of lipoic acid against aflatoxin B1 induced oxidative damage in the liver. What is aflatoxin B1? It's a type of mycotoxin. So going back to what we're just saying, mycotoxins, one of the hallmark symptoms that we see is burning mouth or scalding tongue syndrome with mycotoxin exposures. But what you can see here, alpha-lipoic acid is not only involved in energy metabolism, but also powerful antioxidant that can protect against liver oxidative stress induced by drugs, toxins, under various physiological and pathophysiological conditions. The toxins in this case being mycotoxins. What they found is that liver tissues were injured. They gave these animals aflatoxin B1 and injured their livers on purpose, and that damage was then alleviated by the addition of 300 milligrams per kilogram of lipoic acid. So they gave them liver damage on purpose by exposing them to aflatoxin B1, and then they found that the liver damage was alleviated or repaired as a result of utilizing lipoic acid. Now again, you can't always extrapolate an animal study to human studies. This, of course, done in broiler chicks, and there are many others that have been done, but this is where we start. We oftentimes start by looking at animals first. Now, there's a nice review paper by Sherry Rogers here on lipoic acid as a potential first agent for protection from mycotoxins and for the treatment of mycotoxicosis. So somebody being water damaged, building and being exposed to high levels of mold toxins. You see mycotoxins, toxic substances produced by fungi or molds, are capable of damaging multiple biochemical mechanisms, resulting in a variety of human symptoms, referred to collectively as mycotoxicosis. In fact, mycotoxins mimic xenobiotics. What are xenobiotics? These are chemicals that cause endocrine disruption in humans, not only with respect to their ultimate damage, but also in their routes of detoxification. So in essence, mycotoxins, a lot like xenobiotics in the way they're metabolized by humans and detoxified by humans. This suggests potential therapeutic options for the challenging treatment of mycotoxicosis. And so then they go on to discuss the potential role of lipoic acid. Now, one of the things that we see a lot in my practice is mycotoxin-induced nerve damage and muscle damage, liver damage, etc. And one of the hallmarks to what we use to help people, to support people's recovery is lipoic acid. And we use in our groups, we use 1,200 milligrams per day. And this is usually very effective. What we see a lot of times, just like what they see with the diabetics, with the neuropathy, well, mold toxins can also contribute to neuropathy. We see the burning tongues improving. We see the numbness, the tingling, and the loss of blood flow into the fingertips and toes improving as a result of using alpha-lipoic acid. So I'm not telling all of you who have been in mold that you need to go run out and treat yourself, but I just want to give you information that you could take with your doctor and work with your doctor to come to a better conclusion of what you can do. Knowledge is empowerment. Okay, let's talk next about some of the research studies and weight loss. This is the holy grail of what a lot of people want to try to accomplish is weight loss. So we look here at some of the trials on using lipoic acid in weight loss. So this trial was done in overweight, obese women aged 20 to 50. They gave 1,300 milligrams a day of EPA or 300 milligrams a day. So they were comparing EPA with ALA. EPA is a type of omega-3. But what they found in this group is, irregardless, the ALA-treated groups, the lipoic acid-treated groups had significantly higher body weight loss. So they experienced more weight loss than the groups that were just simply given omega-3 fatty acids. They also had a significantly attenuated decrease in leptin levels. Leptin is a very important hormone that regulates satiety and helps to promote weight loss. So they had improvements in leptin. So the leptin's high, we develop leptin resistance and we become resistant to weight loss. So when you have an attenuated decrease in leptin levels, that's a good thing, especially in people with high leptin. You can see down here in this one, again, overweight, obese women were giving Alpha-Lipoic acid. They found a high reduction in body weight, a reduction in BMI and fat mass. They found significant reduction in glucose levels for the control group with EPA and ALA group. And then this other study here, again, overweight, obese patients, 1,200 milligrams. This study was given over 8 weeks, significant reduction in body weight and waist circumference size. Another study here, obese individuals, 1,200 milligrams a day of ALA and a vitamin E, and this was a 12-week study, significant improvement in serum adiponectin and interleukin-6 levels. Again, these are inflammatory markers that can improve. Remember, extra inflammation equals extra weight. In this study, it was 300 milligrams a day, 10-week duration, significant reduction in circulating levels of saturated fatty acid and total omega-6 fats. In this study, 300 milligrams a day, 10 weeks, significant reduction in BMI and fat mass, in lipoic acid treated groups. So lipoic acid obviously can help support weight loss. So what does the human research on lipoic acid say? Let's summarize a lot of this. Lower blood sugar, fasting, lower hemoglobin A1C, reduction in insulin, improvements in adiponectin, improvements in leptin, lowering of blood pressure, improvements in blood flow function by helping blood vessels dilate properly. We know that it improves functionality in multiple sclerosis patients. We know that lipoic acid has parameter impacts on schizophrenics being treated with anti-schizoaffective drugs. We know that it has improvements in people trying to lose weight. So all these wonderful potential impacts or effects. Now the key in all of this is you can't eat enough lipoic acid to achieve these types of effects. So all of these were done, all these trials were done using therapeutic doses of lipoic acid. And so let's show you kind of what food looks like so you can have a good idea of, here we're talking upwards of 1,200 plus milligrams of lipoic acid a day. But here are your top foods. So you can see a cup of cooked spinach has 3 milligrams of alpha-lipoic acid. You can see kind of the next best thing really is red meat and organ meat at 1 to 2 milligrams for 3 ounces. So depending, if you ate 9 ounces of meat a few times a day, you might get 10 milligrams in total of lipoic acid from your meat. And you can see broccoli at, a cup cooked is 1 milligram, and then you get down into some of these others, and it goes all the way down to, you can see here, 0.4 for potatoes, and that's 1 medium baked potato. So you're not going to achieve this, anywhere close to this 300 plus, 300 to 1,200 milligram plus day therapeutic range. So food isn't going to cut it. And I say that because, look, I'm a huge advocate of food. I think everybody should be eating real food. I think everybody should be striving to accomplish great health through food first. But if you're after some of these research, what we just showed you in research, some of those benefits, you're not going to achieve that with food. You're going to have to go up a notch, if you will. And so let's talk about dosing and forms of lipoic acid and safety of supplementation. And so you can see here, ALA is considered a safe supplement without any adverse effects. One study supports the safety of the drug. An adult can take up to 2,400 without experiencing any harmful adverse effects. So that's a pretty high dose. I typically don't go that high in my practice. But again, this is one study saying that up to 2,400 milligrams should be okay in humans, adult humans, without any major side effects. Now that being said, everybody's different. And I don't think we can base one study's conclusion on the entire globe, on the entire planet. So be aware there are some adverse effects. And you see the most common adverse effects reported were headache, heartburn, nausea, and vomiting. And none of that's fatal, but at the same time, you don't want to struggle through headaches and heartburn all the time for the sake of trying to lower your blood sugar. There are other ways to do it. So if it bothers you, if taking lipoic acid, if this is you, you might reconsider. Don't suffer through the problems to try to achieve or lower the dose. And work with, ideally you want to work with a doctor who addresses nutrition. Not a doctor not trained in nutrition, because those guys and gals, they really won't be able to help you too much because they don't know anything about it. But work with somebody with nutritional background. You see, daily dose of 200 milligrams a day to 2,400 milligrams a day is deemed safe without significant adverse effects. However, there's no reported safe dose in children. So if you're trying to give this to your kids, there's not really been any major research studies on kids. So, just cautionary tale there. Is it dangerous? Probably not. But do you want to go 2,400 milligrams a day for your child? Probably not either. Like, again, work with a good doctor who understands nutrition and who'd be willing to monitor levels to see if it's something they need to do. And you see down here, and this is another study, safety evaluation of lipoic acid supplementation. And this was a systematic review and meta-analysis of the randomized placebo-controlled clinical studies done on humans. So again, this is a summarization of all the research studies done in people with dosage of lipoic acid. And so this was pulled from 71 clinical studies comprising 155 treatment arms, which included 4,749 subjects, with 2,558 subjects treated with ALA and 2,294 assigned to placebo. So they did a meta-analysis on all these folks, right? And what did they find? ALA was not associated with increased risk of any treatment emergent adverse event. In other words, they didn't find any real major problems with people taking the lipoic acid. And so then they did a subset analysis, and they also looked at people who smoke, people with existing cardiovascular disease or the presence of diabetes or pregnancy, people with neurological disorders, rheumatic disorders, as well as severe renal impairment or kidney impairment, and status of children and adolescents at baseline. And they didn't find any problems in those individuals either. So whether you have heart disease, whether you're pregnant, whether you have diabetic neuropathy, whether you have kidney disease, arguably the best review on all the clinical human trials done to date don't really show any major problems. So is it safe? I think it's pretty safe to say lipoic acid is pretty safe. I think the next question is, what's the dosing structure that people should consider? I think that depends on who you are. I think it depends on what you're trying to accomplish or achieve. Ultimately, I think if you're trying to go higher doses of lipoic acid, you probably should work with a professional to kind of help guide you. But at the end of the day, I can just share my own personal clinical experience working with it. I regularly give people this amount. And this is typically under the auspice of we're trying to aid or support detoxification. Typically, in my practice, it's metal and mycotoxins are where we see good effects. That being said, I test everyone. Now, sometimes, even though somebody's not deficient in lipoic acid, I'll still support them when we have a mycotoxin or metal problem. But I'm not going to do it indefinitely. In other words, I'm not going to put them on this amount for years on end without monitoring them. I generally will monitor a person I'll monitor them through blood work every 6 months, but I will monitor them through conversation as well. And so the key here is it's safe to take it. You can take it. You're probably not going to get hurt. These are some of the symptoms you want to look out for. But at the end of the day, if you're trying to be the most intelligent about it, work with somebody who knows what they're doing and test your levels. Now, there are no great serum lab tests for lipoic acid that are commercially available. What we like to use, you've heard me talk about this if you've listened to me for any length of time, one of the best technologies to analyze lipoic acid is intracellular nutrient analysis. And what this does, what this type of testing does, is it actually extrapolates your cells from your body, and then those cells are then stimulated to grow. So growth, and we measure that growth rate is measured, and then we get a baseline. So this is our baseline. So your growth rate of your cells is your baseline. Then we go back and repeat the test, only this time we give the cell whatever nutrient. In this case, we give the cell lipoic acid. And then we remeasure the growth rate. And if the growth rate improves dramatically, generally speaking, if we get a greater than 110% improvement, then what that indicates to us clinically is that your cells performed better, grew better, performed better, functioned better when we gave them lipoic acid. So this can be measured. If you're going to do this, under guidelines of intelligence, I would say get it measured so that you can justify, how long you should take it, and whether or not you should take it, whether or not it would be beneficial. Because lipoic acid is an expensive supplement, and you don't just want to take it just because. Again, I always like to test, not guess. Let's justify the reasoning. That's the most common sense approach to taking this. Now, there's some arguments out there about, what kind of the type, right? So what type of lipoic acid? And it's mixed. The science is not super clear on this. There's something called R form, which some Petri dish studies show better enhanced utilization or absorption. But there's also research studies that show that therapeutically, R form's not really any better, and there actually can be some drawbacks to it. Generally speaking, R form is more expensive. The other problem is all the research in humans is not done with R form. It's done with lactic acid, which is just basically lipoic acid. So I would say if you're looking at taking R form versus not, I don't think there's any huge, tremendous justification in coughing up the extra money for the R form, considering all the studies have been done on non-R form, and those studies are the ones that show the outcomes and the results and the benefits. That being said, the other thing is when you're taking high doses of lipoic acid, one of the nutrients you got to watch out for is biotin. So they compete with each other. So if you're taking high dose lipoic acid, know that they share the same entry mechanisms, and so they're going to compete for uptake. And so it's smart if you're using lipoic acid that you also add some biotin in to your supplementation regimen so as to not create a biotin deficiency. Remember, biotin deficiency can create problems with fat metabolism. It can create problems with your skin. It can cause hair loss. It can cause nail fragility. So you just want to be careful not to take so much lipoic acid for such a long period of time that you end up causing a biotin deficiency, and now you have another problem to deal with. Another reason why I like to test, because when you're testing, when you're testing for lipoic acid and you're using INA, you don't just test lipoic acid, you're also testing biotin among other things. So it's just smarter to be analytical in your approach. Okay, let's talk about one more aspect of lipoic acid, and that is what causes lipoic acid deficiency. Remember that your body can produce lipoic acid, so this is not an essential nutrient that you have to obtain from your diet, because you do have the ability to produce it chemically internally if you have adequate caprylic acid and cysteine. That being said, there are some things that can deplete it or cause your body to need more of it or utilize more of it. One of those is severe stress. What does stress do? Stress, in a sense, causes increases in free radicals, which basically increases the demand for lipoic acid, because what is one of its primary functions? It's in regenerating your antioxidants, your vitamin C, your CoQ10, your glutathione. We also know that the SAD diet, eating processed, ultra-processed foods, high carbohydrate diets that don't provide much nutrition, the diet itself also contributes to an increase in free radicals, which is going to increase your demand for lipoic acid to quench such problems. We also know that gluten-induced damage. So those of you who've read my book, follow me along for a while, know my thoughts about gluten. But gluten can cause tremendous inflammatory damage and thus increase the need for lipoic acid. But the other problem with gluten is that it damages the small intestine, and that damage can reduce your ability to absorb lipoic acid effectively from the food that you eat. Remember, lipoic acid generally, it's got a very, very short life cycle in the body. First of all, it's poorly absorbed, and second of all, it's in and out of the body within about 5 hours. And this is just another reason why eating your way to high levels of lipoic acid, it's rate limiting. You can't eat enough to generate the quantity or the dosing structure to get some of the things that we were talking about in those human trials, because it leaves the body so quickly. And by the time you've ingested one meal, you're full, and you maybe got 2 to 5 of lipoic acid, and it's just or milligrams of lipoic acid, and then you have to wait another several hours before you eat that next meal. But gluten causes damage to the intestines that impairs absorption, right? So now you have a mechanism where the intestines are damaged and you can't get what's in your food either effectively, and so now you're just relying on what your body's making. And gluten causes that increased inflammation, which puts more demand on lipoic acid. And such is true of anything that causes increases in free radicals or that causes pressure or stress on your body. So if you have poor behavioral habits, smoking, lack of exercise, those are all additional factors, this including mold exposure, mycotoxin exposure, additional environmental factors that can contribute to the formation of free radicals that increase the demand of lipoic acid usage by your body to preserve your antioxidant status. So there you have it. Probably more than you ever knew you could learn about lipoic acid. Look, if you found this video helpful, I'd love to hear your comments below. If you've had success stories with lipoic acid, meaning you've taken it and it's improved or enhanced your life in some way, leave a comment below for the next viewers coming along. Maybe it encourages them to, to share in your victory by possibly joining you. Thanks so much for tuning into Dr. Osborne's Zone. Hope you have a fantastic day. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.